Так. А кто модератор-то?
Who's the moderator in this session? Leo? I suggest that we ask Leonid to perform this function. Or we could just as well wait for Leo. Ladies and gentlemen, I would like to open our plenary session. This session will deal with the human capital. This is not a coincidence. Human resources, human capital, is generally recognized to be the main source of long-term sustainable economic growth. On the other hand, human resources are in the focal point of very many studies conducted by many scholars in Higher School of Economics and in other schools. The subject of this session, just like many other themes discussed in the April conference, is special to us. We are going to take a presentation that has been prepared by Higher School of Economics and the Center for Strategic Studies. This presentation is an organic part of the vision of the future of our economy, the future of our social arrangements. I do not want to take too long. Let me just say that many people made contributions to this presentation, and what we're having here is a short version. However, Mr. Kuzminov and Mrs. Ovcharova were in charge of these efforts, and they are the presenters today. Lydia is going to be the main presenter, and then we will invite Yaroslav to make additional comments. Lilia, over to you. How much time do you need? Please make sure you push the microphone button. I'm going to need 20 minutes, and please tell me when I use my first 15 minutes. Ladies and gentlemen, Leah already said that we worked together with the Center of Strategic Studies. Center for Strategic Studies. When we developed the strategy, it included not only human resources but several other things. We had a lot of debates over this, and we decided that we should have three main areas to focus on. Based on that, we developed proposals for the human resources section. We have made 5 sub-presentations. They are available at the entrance to this room. They're also available at the Center for Strategic Studies website. We did a lot of preliminary work to put together some policies to create a framework. First of all, we came up with some proposals for changes. I'm responding to what Mr. Makarov said yesterday. He said that we encourage people to invest in education and healthcare without any reforms. I disagree. We are talking about changes, reforms. We have had situations in the past when we had changes that were not supported with money, and we realized that this was not a way to go. When we want to conduct change, we need to substantiate our efforts with an appropriate amount of cash. If we ignore challenges we are faced with, we may see our reforms failing. One part of our work was to identify priorities that show the greatest prospects. And another thing we did was we studied the level of maturity of our models. Today, we are trying to adapt our vision and strategy to the level of maturity of the environment that we are dealing with. We were creating the language for our presentation, and we focused on two things. We wanted to show new solutions in the first place, and secondly, we realized that there were a lot of solutions that had to be taken to the end, recent solutions. I'm talking about things like restructuring of healthcare system. It has to be finalized, completed. Amongst the newest solutions, I can mention the decision to raise minimum wages. We assumed that it would happen, and we have to support it. Today, I would like to talk about some key new solutions. The rest of it you can read at the website. Before I talk about the key decisions, I want to explain why we chose specific priorities. Priorities have to do with the challenges that we are facing. Yesterday, we have mentioned some important points in the plenary session. This was good. People are quite enthusiastic about human resources and human capital theme. Demographic challenges that we are facing are quite severe. We have a declining share of working age population, and we have more people of older ages. So the population is aging. We have to face that and take the challenge. We knew about these things well ahead of time. It's easy to make forecasts in demographics. We have been turning a blind eye at those challenges, but now they have become so important that we can't do it any longer. Another big challenge that we are facing today is insufficient capitalization of human capital. I believe that this is a big subject that deserves thorough discussion. We have had a lot of conversations on this, and I'm going to talk about human capital development index. There are 4 parts to it, 4 components, 4 parameters. We rate 16th in this. In formal education level, we are in the 4th position, which is not bad. In use of knowledge, we are in the 18th place. This has to do with employment and unemployment. Then the next parameter is continuous education. We rate 33rd. And the final fourth parameter is new knowledge and skills. The point is, as the saying goes, if you're so smart, why are you so poor? The formal education is not bad, however, we do not have sufficient outcome from that. We realized that people do not view education as a 21st century capital. People get education just to be a good, educated, knowledgeable person, but it's not a tool that helps people to earn more money. People have more faith in social capital rather than educational capital. We have fairly good potential in average life expectancy. We have data that tells us that in the 60s our life expectancy level was very high. Now we have exceeded those levels, life expectancy at birth. However, when we look at life expectancy after 15 years, the picture is different. We understand if our priority is to reach the level 80 plus, then we have to understand how we can get there. And now another subject that is interrelated, that is high mortality amongst men. As Sergei Shishkin says, we are amongst the 18th countries with the highest male mortality. Behind us, we only have a number of African countries that are war-stricken. The level of poverty is rather high, but that is not the big challenge. There are growing poverty risks for children. When we say that we have a shrinking number of working age population, it means that young people are going to carry the big burden of providing for the elderly people, for the retired people who will rely upon the younger generation. We know that poverty has a lot to do with lack of success in school years. Yaroslav is going to talk more about it when the time comes. The fact is, every one child out of 5 grows up in a poor family with low poverty risks for elderly people, monetary poverty. We have high subjective poverty risks. That has to do with the fact that elderly people save quite a lot on food to ensure that they get better care and to get more health care services. This means that there are 3 areas where we will need budget maneuver. That is education, healthcare, and social support. I will talk about those things later. And now I want to comment on something else. 3 other priorities are the areas where we need to change a political paradigm. One area is migration. We have to become more friendly to the people with high level of professional skills, and university students from other countries that study in Russian universities. We also are going to see changes in the labor market. This market is now going through serious transformation. What we are witnessing now is that we have a new law that requires that minimum wages have to be at least at the level of subsistence level, which is deviation from the traditional course. We do not know how the economy is going to respond to this new legislation. Another thing that the government did was launching a project for a nationwide labor performance increase. That puts us in a new environment with new priorities. And our experts have developed a number of proposals that have to do with development of creative industries. This is a very interesting project indeed, and we are now trying to make it a part of the overall project. Education, healthcare, and social support are global things, and we have to be in line with what is done in these areas. We cannot be late or we miss the train altogether. Today, 35% of the population in the country is using mortgage lending to acquire an apartment or a house. This resembles a situation in the United States when quite a lot of people that could not afford housing got mortgage loans. Now, I would like to talk about some proposals that we generated. We analyzed risks. We have set a number of tools. We decided on the methodology, and we thought that we would get the best synergy in the education system. Before I comment on some of the solutions that we would like to propose for the education system, I want to say one thing. We had an interesting debate. It's actually an ongoing debate whether we should invest in human resources if the institutes show no demand for that. Maybe this is going to be an ineffective investment. We spend resources on training, and nobody needs those skills. The demand for human resources should be one of the main drivers for economic development. Today, we are focused on non-commodity related growth. We realize that there are three growing markets: healthcare, education, and creative industries. Those areas are going to see the highest rate of development. We thought that it would be important to think about export opportunities for the services provided in healthcare, education, and creative industries. Next, I want to comment very quickly, if I may, on the following things. I have identified several groups of projects. In one, we focus on completion of the model of continuous learning system. We do not have much support for early development systems, and we have not yet launched a model of continuous education. This means that people in higher ages do not get frequently retrained to improve their level of skills and experience. Another area that raises a lot of interest is the state of modern school. The schools that we should have at the age of digital technologies. This digital part is fairly interesting. The experts that were helping us have done thorough analysis, and it is telling us that the digital environment is mature enough. We can start digital schools. There are three types of digital resources: digital textbooks, digital learning facilities. We can offer online training courses, and thirdly, we can make much bigger use of specialized simulators that should help students. If we are to do these things in our schools, we believe that we may see a serious breakthrough. Next subject is professional education. We believe that universities should become regional centers of education. We believe that we should encourage schools to do more in the way of research and scientific studies in universities that belong to the Russian Academy of Science. We also believe that universities should develop their capabilities for export of services. Next point, we have a project that we view as a flagship project. We have worked on it very hard together with the Center for Strategic Studies. We understand that we need a technology leap, technology breakthrough. We want to launch this initiative first as a regional initiative to make it kind of a pilot where we can try several new things. When somebody says that we cannot do it with available resources, it means that we have to come up with more resources and still do it. We believe that we need to have a number of disruptive projects for the whole system of education. We want to give all students equal learning opportunities to assure their success in life. In the past, we have been ignoring this. Many students ended up unsuccessful after graduation. We cannot turn away from that. Today, we see that the level of inequality is growing. The gap is becoming wider. We need to respond to that. Coming to the end of my presentation, what is important is to develop talent and have sufficient resources for the system of education. There are several priority areas. We've identified 5 of them. We worked as partners with the ministry, and we developed a number of proposals. that have become a part of the development strategy. There are some things that I want to quickly comment on. One, we need improvement at the grassroots level. That is availability of quality healthcare services. A lot of people are not turning for medical help until it's rather late. People wait till they are seriously sick, and only then they would call a doctor. And in most cases, they would immediately be taken to hospital and have to take serious treatment, which is quite costly. We have to improve availability of first medical help at the grassroots level. We continuously talk to the ministry about that. It's not like the Ministry of Healthcare disagrees with that, but they do not view it as a high priority. We also believe that we should change the approach to patients with chronic diseases. Another area that we view as a priority has been discussed profoundly. We had some people, some partners disagreeing with that. They think that this is something that can wait. We think that a provision of sufficient and effective medication is very important. The next area is encouragement of healthy lifestyle. This is a fairly traditional thing. Fourth area is increased effectiveness of the management and better use of funds in healthcare. We want to use the resources of healthcare insurance. That is the model that has great prospects. We strongly believe in health insurance. We also believe that we need new technologies. We need to have disruptive technologies in healthcare. And this is also an area where we believe we have quite a bit to offer to the world. We want to develop technology centers that can export their services and solutions. Next area is social support system. Social support is extremely important for not so well-to-do families with children. The subject is extremely important, and we have witnessed a number of reforms. Today we are somewhat tired of reforms. For a number of years we have been refusing to make the decision to raise retirement age. We have been finding all kinds of excuses for that. I think it's time to make that decision if we really want to come to the life expectancy level 80 plus. We need to encourage the development of the market of supporting technologies that will keep people healthy. We believe that we should be spending extra 0.8% of GDP on education. For healthcare, we need to additionally spend 0.66% of GDP. For social programs, They are quite expensive. However, there are some internal reserves, and we believe that we could do with extra 0.2% of the GDP to support extra social programs. Now I am done, and I pass it over to Yaroslav. Ladies and gentlemen, I think we would be using our time much better if we take questions from the audience. Let me point to one thing. It is a bit obvious, but still, the presenters will be able to respond to comments and questions and may explain their vision more profoundly. Let us open the floor for questions and answers. We have invited a number of colleagues to make their comments on the presentation, a short version of the presentation. As you can see, even the short version is not very short. We really appreciate the efforts of those who have already familiarized themselves with this document. So we want to start by giving the floor to people who are familiar with the presentation, and we hope we are going to have time for general discussion, following which the presenters will make their final comments. Alexei, over to you. I share and support the main statements of the presentation. I have made my contribution to this piece of work. I'm one of the authors. The statements that you find in the presentation have been discussed at very many occasions. This presentation is connected to a number of other documents and studies that we have done. Today we have just published another strategic document that is the priorities for the strategy, where we quickly outline our approach to the main challenges. I will not talk about small technicalities. Today at our website you can find this document, the structure of the strategy that we are proposing. We analyzed sources of growth, and the average growth rate in recent years has been 1%. Since 1930s, we have not had such a long period of time with such a low growth rate. We're all responsible for this. We find ourselves in stagnation. This is obvious in many different fields. We are lagging behind, and our share of world GDP is getting smaller. We are also lagging behind in new technologies. We have been increasing real wages in early 2000s. However, in the last 6 years, we have not had any real growth of population income. We have seen some growth, then we had decline, and now we are at the same level where we were 6 or 7 years ago. Today, this is not economic crisis per se, but we have exhausted the sources of growth that we were tapping in the past. Growth cannot rely on the growing human resources. We are going to see a reduction of working age population by 10 million people. That is going to directly impact our GDP. if we focus on investment that will not take us to the growth rate that we want. We need a different level of performance, and this desirable level of performance can only be achieved through better human resources and better technologies. We should have better skills, better abilities that we have to develop. We have to train our people. This is becoming the most valuable resource. I am talking about human capital. We need high-quality human resources. That should be one of our main priorities. The quality of education is not up to the challenges that we are facing. Let me tell you another thing. We have analyzed the situation, and we pretty much agreed that performance improvement is one of the main parameters that we're looking for. We usually use total factor productivity as an important parameter that includes the quality of infrastructure, the quality of management and administration. That gives us the desirable level of performance. When we look at GDP per capita, we are not even at the level of 50% of European countries. We want to become leaders in economic development. We want to become leaders in technology development. Innovative development is probably the biggest bottleneck area that we are witnessing. Soviet Union had a model for technology development. It was unique. It was different from what others were using. It was a comprehensive model that covered education at all levels. Elementary education, secondary education, professional, higher education, on-the-job training. This model, though, is gone, and we do not have a new model. We have not put in place any replacement. This happened due to financial difficulties in 1990s. We lost this model of innovative development, and we need to build it from scratch. In fact, many efforts have already been made. There's been quite a few organizations that were given this task, but this work has never been taken to the end. We don't want to miss on the new opportunities associated with technologies. We cannot miss the train of technology revolution. If that happens, we are going to see greater inequality between countries. We'll be losing markets in the next 6 to 10 years. It will be easy to observe it. We can see how we're losing market share in space programs, and we will be losing other markets where we think we are quite strong. We should focus on that, and human resources play a decisive role. There is a broad notion of human resources that we are using. It's not just about social policy. It's not just about fighting poverty, which is an important task. In poor families, children do not get proper development. They have fewer opportunities to study. They do not perform so well in schools. I want to talk about human capital in the new environment, in urban environment. We place special focus on development of urban environments, In the latest address by the President, there is quite a lot of language on development of city environment. It's not just about landscaping. We use a much broader notion. If you look at big cities with over 1 million residents, you can see that young people do not find a comfortable place for them in their home cities. Many of them want to move to the capital. We should respond to that. We should create industries that are still underdeveloped. We should give people an opportunity to feel comfortable in their home space. Let me draw your attention to another thing that has to do with government administration. We need administrators of much higher quality. We want administrators to have a higher level of professional training. This is vital for administrative reforms. We have done serious studies. We call healthcare and education system expenditures productive expenditures. We developed a model that we were using in our studies, and we have put it to a number of tests looking at the last 7 years. We have looked at the opportunities associated with the budget maneuver for years to come. What would happen if we decided to spend more on healthcare, education, and infrastructure? The changes that we have witnessed in the last 7 years had to do with defense and retirement. We are spending more on pensions since 2002, and the increase is equal to 3% of GDP, which is not a small thing in today's prices. That is 2.5 trillion rubles. That's what we are spending on the pension system every year since 2010. Certainly, pensioners need it, and this was quite a rational step. But that, together with defense spending that amounts to 1.5% of GDP, that was quite a serious budget maneuver. 4.5% of GDP has been redirected towards social expenditures and defense spendings. We have seen shrinking spendings on healthcare during the same period of time. What we propose is that we should do a smaller budget maneuver that will change by only 2.3% of the GDP. Approximately 0.7% more should go into the healthcare, and about 0.8% should go into infrastructure because it's not adequate to our development goals. What is this 0.8%? Today we're spending about 3.2 trillion on education. We're talking about extra 750 billion. I'm not saying that we should spend that in 1 year, and it's not like we only provide cash. We should have support for specific projects. We have received a lot of criticism. We had to describe specific projects that we would like to support. Without specific projects, those allocations will not bring us desirable results. We believe that Russia has the capability to carry out such programs. 750 billion per annum is not as much as what we did within budget maneuvers in the past. 750 billion, that is the cost associated with the Winter Olympics. Or look at other big events like 340 billion that we spend on preparation for the FIFA World Cup. 750 billion, that is what the government spends in 1 year. And that is something doable without us having to increase taxes. We need to launch the new model of economic growth. If we were to do that at the same time as we raise tax rates, it probably wouldn't fly. The budget maneuver in the past took away 0.5% of growth per annum. The maneuver that we are proposing will give us extra 0.5% of GDP growth. In 5 to 6 years, we may see even more. That is 0.79% of GDP growth. We should also see cumulative effects. I would like to talk more about education because this is the key subject of our session. This is a very important area. However, I will only mention 3 things in conclusion of my remarks.
When I say that we need to fight for every student and their abilities, what we mean by this in our strategy is the priority we called everyone is important. And we need to expand our understanding. And that understanding is that we have to fight for everyone. It should start at birth, and then we would essentially accompany children as they grow up, providing them with education capabilities. But we need to look at whether we have the right talent that would be doing this. The sociologists and psychologists, would they have the methodologies that they would require? It's not just a matter of teaching one more psychologist. We're talking about developing the methodologies. I've been familiarized with the American and European systems, and this model has been in existence there for decades. It is something that is more available and accessible to the richer population, and it is present in the private schools, but it is quite intense. And there are a lot of approaches to socializing a child, helping a child to be successful. In our schools, I've been trying to learn about this, whether it exists or not, but I found that it only exists in just a very limited number of cases where you have really enthusiasts and professionals, true professionals. They would have streams of students that would be treated like that. You would have special classes. This is something they try to do in schools where they make certain adjustments to the curricula for underdeveloped children, but this is something that we need to talk about. And when we talk about our maneuver tasks, we need to do this over a period of 6 years, step by step. We need to train experts in education at universities, and then we would essentially scale this down to the level of schools and nursery schools. It's going to be a separate story with the universities and their ability to work for the market and for the future of the market, not just the past, but the future. Just recently there was a conference held at the St. Petersburg University where we discussed the role of interdisciplinary approaches to future education and whether the market is in demand. And the market requires students that would be able to adjust quickly, change their zones of specialization. On average, a person changes his workplace 8 times throughout his career. Again, this is on average, but then very often they would move into areas that had not been connected to the person's initial education. So today you are a car salesman, and then the next day you will be selling shampoo. And of course there are certain rules that would apply to each area of expertise. You would adjust your skills and competencies, but when we started to study this, and it's our department, we have this interdisciplinary approach as a matter of mandatory approach. And we try to make sure that this is done at the seam between different disciplines. And the results that we will obtain so far are quite interesting. But some parents do not understand the interdisciplinary approach. They really need their child to become a physicist, a mathematician, or an engineer in a given area. The society lacks the understanding of why this is important. These methodologies have not yet been implemented at the universities on a broad scale, and we've just entered this river. And let me share another story with you. But before I do that, I think this is something that should be targeting the interests of the market, the business community, and their requests. They often say that they still lack qualified talent, and what we graduate from our universities is something that we need to train later. I could mention other things as well, other examples of how we are a little bit lagging behind the challenges of the economy. And maybe the third example, it deals with China. In the naught years, China would be sending around 100,000 students to foreign countries a year. And about 80 or 90% of those students would stay to live in those countries where they studied. They went to the best of the countries. China identified their approaches, which universities to choose. They've signed agreements with the schools. And I lectured at the Edinburgh University, and they had 1,500 Chinese universities, and that's one of the universities that they selected, and that university is one of the top 20. Right now, the Chinese are sending 500,000 students to foreign universities, but they understand they are not going to be able to overcome this gap just using their own students, rather their own professors, to teach their students everything they would be required to be able to do in the future. They just send them out to foreign nations. And they're not afraid of the problems with ideology. They are very bold about it. And now they are returning back to China. Out of the 500,000, 90% return back. China has already created those industries that demand these qualified experts. And this transition took over a period of 15 to 16 years. And the very last comment I wanted to make about this is that we have certain constraints at universities in terms of establishing connections and links with foreign universities. It looks like it's counterintuitive. We have grants, we have liaisons with the university, but we have certain constraints on that, especially in the humanitarian areas. And that is despite the fact that there are programs that would send students to Western universities. On the one hand, we send our students there, but we invite less of qualified professors here. And thank you. Thank you, Mr. Kudrin. We will continue this discussion now, but let me point out that the subject of education is indeed pivotal when it comes to the human capital, and this is something we're going to be discussing in this very room after the break. We will have a presentation that will be made available to all the participants, to all of the conference. But let me make a comment. Mr. Kudrin made a point, and if you were not at the economic future session yesterday, this is the same thing that Mr. Reshkin was emphasizing. What he pointed out was that when the main engine of the economic development is the human capital, what you achieve by this, you are overcoming the traditional juxtaposition of the economic benefit and the humanitarian matters. It has always been important, but we would be saying that this is done not for economic reasons, but for other reasons. But now these criteria are becoming more aligned, and this is what Mr. Areshkin was talking about yesterday. The humanitarian component of the economic knowledge is becoming critical for us to be able to understand how to develop the economy, how to grow it, and we need not just mathematics and the traditional economic disciplines like accounting, but we also need a very strong humanitarian basis and foundation. And here we are feeling that some lack exists, and many people fail to understand that in order to speed up the economic growth, we cannot afford to, limit ourselves in the development of the humanitarian studies. And we would continue this discussion. We would give the floor to those who had asked to be given the floor ahead of time, and then we would have a general discussion. And I would like to give the floor to the accounts advisor to the president of the president, Ms. Zelinskaya. Thank you, dear colleagues. The first thing I would like to point out is that a year has elapsed, and the approach since then has changed considerably. The approach to what should be the social factors and the approach to the importance of the human capital and the human contribution to the economic growth and the value of everyone in the economic and social development of the nation. And maybe we should put at the forefront the social development more than anything else. The other point I wanted to point out is that the presentations have been structured in such a way, and this is definitely something that I should compliment the organizers for. They were put together in such a way that we are not just stating the fact, but we are making suggestions as to what needs to be done to improve. Let me also comment on some of the specific pieces of the presentations that we have heard, and hopefully we will be able to work on those issues. The presentation started with demographics, and over the recent years, let me remind you that demographics has been selected as one of the priorities. Back in 2005, this decision was made, and we've been able to achieve certain results. We've implemented a number of programs, and we will continue implementing these programs. Let me also note that when we started this, I'm reminded that Mr. Kudrin said back then that our demographic indicators, especially the mortality data and the infant mortality, are the factors that limit our development. I would like to say that now we just need to maybe move away from focusing just on the mortality rates, go back from this binary approach, dichotomy, alive or not, and do a more thorough analysis of the states of health of our citizens, especially at the phase where this is bordering on making a person a handicapped individual. In our case, invalidity remains, despite the measures that have been taken, it remains at about the same level. For some time, this has stayed at the level of 10.5 million people. This is a significant number, but the structure of this stratum of the society is quite important. We should note that the number of children with problems that lead to invalidity is growing, and this is something that we've been noticing over the last 4 years, and this is the phenomenon that requires further analysis. This is something that is growing, and as of the 1st of January 2017, we had 625,000 children with invalidity, and a year later we had 651,000 children of the same category. What is also important to say is that primarily we have people with mental handicaps in this group of handicapped children. And let me go back to what Mr. Kudrin said earlier. We're talking about the philosophical concepts about the importance of everyone. It means that every one of those children is important. We have to have a clear understanding of where we have the limitations of our existing healthcare system so that we could use it to prevent disease from occurring and recurring, and treat the disease properly. What can we do here? And secondly, we need to learn to work with these people. And our public requires our systems to be involved with working with these children at the earliest stage possible. It is a comprehensive approach that we would need to take. And this is the approach we need to take at all phases of the children's development, and it has to be an interdisciplinary and interagency approach, and this is where we may have some area of inefficiency. This inefficiency is in the fact that we do not have a properly structured system of public administration where various agencies would work together, meaning that there would be mechanisms for addressing the needs jointly of a specific individual, be that a child or an adult. And here, every agency is trying to build its own circuit. And this circuit is designed to involve people from the healthcare industry, from education industry, psychologists, and speech therapists. And there is a term called PMPK that stands for psychology, medicine, pedagogy, and it's a commission. Why is this an important point? The system works in such a way that the healthcare industry would give you one set of recommendations, and this commission, with all due respect, it is a proper and legitimate institution, would reject those recommendations. As a result, we would have lack of satisfaction with the end result, and we would also have a lot of expenditures we would have to incur, and we do not achieve the desired effect. Therefore, we need to build these new interagency approaches. This is going to be a separate objective we would need to try to attain, and we need to approach it from various angles. And maybe over the last 3 or 4 years, people keep saying that we need this interdisciplinary and interagency approach, but we haven't been able to implement it so far. And another example, if I may, there was a national project dealing with the high medical technologies, and Lilia Borisovna was one of the initiators of this, and we were trying to expand our use of transplants. And certainly this is the type of medical care that is considered to be high-tech, and these operations are certainly planned for in advance, but children need to be prepared for their future lives, for school, and that is where this disciplinary subject hasn't yet been properly expounded upon. Now, I would like to say a few words about poverty. I have some questions I would like to ask, and I understand that this discussion was an open discussion, and Tatiana Golikov at the meeting at the Ministry of Finance touched upon the issue of a proper definition for poverty. Whenever we talk about this, about targeted assistance, and I will dwell upon this matter later, it would be nice to get some experts' advice on whether it is appropriate for us to base our poverty notion on the level of subsistence that is calculated based on the consumer product basket, something that is imposed by the law and has a certain structure, and do that over the periods that will continue well into 2024. It was mentioned in the presentation that our pensioners not really poor, but they perceive themselves to be. And if we keep convincing people that they are not poor and they have 1.5 times the subsistence level, as has been mentioned by some of the members of the cabinet, and people still disagree with that. They do not believe that they are really that well off. So that is a problem. And when we start calculating that a family would be regarded poor only in terms of their income size, but their children may be disadvantaged and would have difficulty with getting proper education, that would mean that we need to take a broader look at this. What should these children have access to in order to be able to be under the same conditions with the others, so that they could fully utilize the potential that they were given at birth? Speaking about the targeted assistance, a lot of people are talking about this. Nobody seems to argue with the need of this, but it seems to me that this is something that probably needs to be more clearly defined. It follows from many speeches that it's just a matter of providing subsidies or some sorts of allowances. It's just a matter of deciding who deserves, who is entitled an allowance, who doesn't. But there are also cases in people's lives. They can be temporary circumstances, or they may arrive and emerge with age and with the change in status, whether the person lives alone or with the family. And there was another term that somebody has suggested to me. It's the ability of the person to maintain an autonomous life. And in many cases, in some cases, money is not going to be really helpful, because this social assistance may manifest itself in other things. So this means that we probably would need to have another set of measures, methods of assistance to make sure that people would feel not poor. If a person has the money in his drawer, but he cannot really walk down the stairs and buy food, that's a serious problem. And another issue I would like to talk about when we talk about poverty, living conditions and living standards are important to consider here. What are the living standards? That includes the state of the accommodation that people get to enjoy. This is certainly no secret. We have a lot of buildings that are on the brink of starting to deteriorate, and they need to be repaired. And this is something that would need to be addressed. There have been some programmatic approaches that have been put forward in accordance with the May decrees of the president. But from the standpoint of poverty, we're talking about people that quite often live in the housing which is deteriorating, about to collapse, and they still pay for their utilities at the rates that are comparable with that of the rates that are being paid by those living in good housing conditions. And that's what the president addressed in his address, and this is something that we need to fix. We need to pay a very close attention to this. And if we talk about the public utilities that people get access to, we would see that these services, or rather the rates of these services, are growing at an increasing rate compared with the other rates, and they're a significant portion of people's expenses, but they're also growing unpredictably in some regions of the nation, because this is what the legislation allows. It is very important to know that people, or some people at least, cannot afford to buy housing using mortgage loans, and they cannot afford to become owners. And I'm about to complete my comments, and this is the factor that we need to work on. And the very last thing I wanted to say, I've read through several reports. I don't have the feeling that we have a very clear concept for the potential investments in the area of healthcare and education. I'm talking about private investors, not citizens. The investors that would get the clear signal that the state is also going to contribute investment in these areas. The state has priorities for such investments, both in healthcare area and in the education area, that the government understands what the rates are, the size of the payments that would be made for the people that are part of the compulsory medical insurance system. And it is a serious resource that we need to tap. Maybe the developers of the concept didn't take those funds into account, and they didn't see the private investments forthcoming. Maybe that's why. And I would like to hear an answer to this. Thank you very much. And let me say that right after lunch in the building across the street, there would be another plenary session that would be dedicated to the new tools and instruments of investment policies, including investments in the social sphere, and that's going to be emphasized. And of course, we are still at this stage of, well, I would call an initial stage of developing this area of study. It certainly has a lot of promise, and I have no doubt that the participants of this effort, they've been paying a lot of attention to the previous steps in order to build a holistic understanding of what needs to be done. And now I think they're going to be focusing more on how this can be done, so that we could consolidate our effort on achieving the important social result. And we see those problems, and now I would like to give the floor to Yuri Voronin, the head of the administration at the Controller's Office. Thank you. Dear colleagues, our experience shows that time flies very quickly, and the same goes for the time allotted for my speech. And as Lev told me, I had to prepare a presentation, and as an individual who doesn't know the answers to the questions that arise, because this is something we need to search for together with the authors of this presentation, but these questions have already been formulated, and other colleagues will answer those questions, and the authors would answer them, and we'll together be searching for these answers to these very complex questions. Because we're talking very comprehensive and large-scale refurbishment and reconstruction of our system, and we're going to be pioneers here and trailblazers, although we may not know it, but we have to address these challenges. But let me talk about the priorities that my colleague here mentioned as one of the elements of the human capital policy. I do not know if we can really make them truly comparable, and I think Mr. Kudrin really focused properly on the production costs or production type of costs, because the healthcare industry and the education industry were selected as the areas where the budget investments should give a different return, because this is associated with new technologies in healthcare, something that deals with the life expectancy issue, and the same goes for the education. We need to proceed from the realization that we are a European country. We are affected by all of the European trends, and no matter what efforts we take, we're not going to be able to achieve the birth rates that some of the other countries are able to achieve. And as a European country that tries to deal with the problem of demographics, we would have to focus on increasing our life expectancy. That's going to be the key task in terms of increasing the population of Russia. But this begs the question, and I still cannot find an answer to this question. we still fail to find an answer to this. What is going to be happening in the field of the so-called social care, permanent social care or temporary social care system? One of the challenges of aging is that to an extent greater than that of the retirement age, that it requires to create a system for social care, because this is where those risks manifest themselves even more clearer when certain diseases transpire. We're talking about the technologies of care. We are talking about creating the opportunity for the seniors and for the handicapped to create conditions that would allow them to feel included in the society. And of course, this is something that's going to be requiring quite a substantial expenditure, and therefore investment is required. We are a European nation with a high percentage of the handicapped in its population, and we need to be mindful of this. And unlike many European countries, we barely invest anything in the effective rehabilitation of the handicapped. They have the whole industry existing in the European countries, and the insurers are spending more at and on returning the handicapped back to the labor market. And that is something that ultimately allows you to save in the long run, because you would return the person to the labor market and that individual would be getting the proper salary. But for that to happen, you need to have significant investment and the technologies that would enable you to do this. And this is something that is enabled by the advent of robotics and by automation, something that would make the integration and reintegration of the handicapped in the labor market more effective. And this should be regardless of the age. As the manual professions are getting into oblivion, people are going to be able to perform work as they even get older than before, and therefore they will be required to possess new skills and new competences. So this is the sphere I think we need to focus on. It's not necessarily directly related to healthcare. It deals with the rehabilitation, and this should be treated as a matter of priority. The second question that arrives is something that has been asked on multiple occasions, but let me mention this. If we essentially bank on the human capital policy as the basis for our social policy, we should be saying that the investment in healthcare, education, and rehabilitation industries would only be recouped when the individual gets an adequate salary, and that would motivate people to return to normal life. But we are observing an objective trend, not just here, but also in the European nations and in the United States and in Canada. And the trend is that the entrepreneurs are trying to save on paying wages and salaries. In the past, there was an explanation as to why this had been happening, but the current president of the United States is now taking really formidable steps to return production facilities back to the United States. And they had left the United States in the first place because the employers did not want to bear the costs of salaries and social benefits, so they had to move their production facilities to other nations where there is no social insurance in place, and they would be saving a lot of money on paying less salaries. But the human capital policy requires a different policy with regard to the salary. The salary is supposed to be growing, and whenever we talk about salaries, whether we want it or not, we need to talk about what follows, which is social insurance, because for individuals it is important to have the salary while they're working, but it is equally important for them to know that if they lose the ability to work, there would be a mechanism in place that would allow such individuals to at least partially make up for the lost salary that that individual had prior to leaving work. And salaries and social insurance, they go hand in hand, and there are contributions that people make from their salaries, and they can call it different things, a deferred salary and so on and so forth, but this is something that is done in order to support people while they are not able to work. Another point I would like to make is this. We need to understand the context of what we're discussing when we talk about the human capital policy, because we are beginning now the new 6-year presidential cycle, and this is when this policy is going to be implemented. And these contexts, if we judge by what was mentioned in the address, what the expert community is talking about, what Mr. Kuzminov was talking about today, we need to have in place a position on the budget maneuver that would support our approaches to the human capital policy. But we also need to discuss the tax or the fiscal maneuver, which had not been widely discussed prior to the elections, but it will be discussed again. And we can discuss the budget maneuver outside the bounds of the tax maneuver would be inappropriate. And we are talking about the reduction of the insurance premiums by 8 percentage points. So this is the matter that needs to be looked at from the holistic standpoint. It's otherwise neither the budget maneuver nor the tax maneuver would be possible, or many other things for that matter. And if we are not successful, we can basically close the situation with the contributory tax schemes, because we're not going to be able to unfreeze those frozen pension contributions. We're not going to be able to go back to that. And the situation under which it is important and necessary to concurrently do the budget and the tax maneuvers, if there is a plan to do that, it means that we would have to do some redistribution of the existing forms of social protection in the context or from the standpoint of the sources for these contributions. So really we have 3 sources: self-protection, which we do not use as yet, and this is something that needs to be discussed. When can we initiate this approach to contributions? So it's the budget and the social insurance, and we have to divide this between these sources. If somebody is no longer covered by social insurance, then we would have to make up for that out of the budget, and this is all interrelated. Since Alexandra mentioned the issue of poverty, let me just say a couple of words at the end. Indeed, it is something that is a matter of the metrics. How do you measure and quantify what should be the targeted social protection, and what should be the subsistence level, the appropriate subsistence level? Although it was introduced as a temporary measure, it has been with us since 1992. Because the subsistence level is the criteria for below poverty levels. And we can talk about the minimum consumer budget, although in Europe they've already gone away from that, and they just look at what should be the share of expenses in consumption. And there are certain physiological needs that people need to be able to satisfy. But I have a lot more things to say, but since I'm being moderated, thank you very much for giving me the opportunity to speak about this.
I have a question, a clarification question. Do you believe that we should further develop the notion of consistence level? If we assume that the minimum permissible wage is equal to subsistence level, then that puts us in the situation of the 20th century rather than 21st century. I think we should have another discussion of this matter here shortly. Everything is just starting, as you can see. It is obvious that this subject and the presentation that we have heard shows us a strong need for discussion. I would like to now pass the floor to Mr. Nazarov and Mr. Gantmacher for very quick presentations, or rather comments. And then I said I would give the opportunity to the presenters to respond to comments. We see, though, that our discussion goes on, and we would appreciate it if the participants of this discussion come back to us. Very quickly, I want to touch upon two things. They have been mentioned in the presidential address. Lev Ilyich, thank you very much for giving us your idea to meet and talk about various approaches to targeted help to the people in need. We do think that there are many things to talk about. The President has given us an ambitious task to reduce the number of the poor by half. I think we should remember about the subsistence level. 22 million people are below that line, regardless of how low it is. 22 million people in the country have income below subsistence level. And my colleagues are right. We cannot limit ourselves just to the income level, and we cannot look at one individual separately. We should look at households, and we should look at the real level of need. We should look at the state of a household. We should look at the property that belongs to the household. It is high time that we started building a database with information about the country residents. We had a lot of siloed databases, and agencies wouldn't talk to each other. That is the situation that is pervasive. We do not have the big picture. We do not know what is happening. In a poverty situation, we do not know simple facts. We need to know more about households, what kind of incomes they have, what kind of property they have, whether they have any people with disabilities. Only based on that we can make any decisions. We can talk about various resources and opportunities that we have to address the challenges facing us. We see that the pension fund has taken a different journey that is not related to what other agencies are doing. They are not talking to each other. They haven't even met yet. So much for the poverty. Now on the health care. In 2014, the President said in his address that we need to use insurance-based healthcare system. I believe that the challenges that Lilia has identified clearly show us that insurance-based model would be the best tool to respond to the challenges. If we don't want to go in that direction, we should go back to the President and tell him that he is wrong and we should not do it. I think that the President was right, though. Well, Valentina Matvienko said that, as you may have heard. Somebody else should go and say, no, it does work. So yes, we should just check. We should plug it in the first place. We have acquired the box in 1990s, but we never plugged it into the wall. So we need to slowly start introducing insurance-based model. That is the main purpose. And the final point that I want to make in response to what Alexandra said, healthcare, education, and technology should become priorities for us. And that would require extra investment. That is kind of obvious. The simplest thing would be to allow people to use extra funds for maneuver, and then we should follow up on that and do more with tariffs. That is a much more complex matter. I think that is something that can wait until tomorrow. Yevgeny, over to you. I probably have about 3 minutes. I'm sorry I did a poor job as a moderator. Well, social policy, well, you can have 5 minutes, that's fine. Look, the presentation was interesting. I am familiar with the situation. I am familiar with the proposals in different sections, in different chapters of this presentation. Very nice, very good piece of work. However, opponents usually want to know what would have to be done at the following stage. We are familiar with the 2020 strategy. We know about proposals made by Mr. Graf. There have been quite a few programs that have to do with this sphere. What we're lacking, we are not paying enough attention to political economy. My colleague mentioned the level of maturity of the environment, and that really made me wonder. If we start thinking whether we're ready for reforms or not ready for reforms, that is not going to take us anywhere. We certainly need to develop human resources. In the 21st century, we're facing new challenges in the labor market. There are many other challenges that have emerged recently as well. Those things are important. They are important for production of services. If we look at the social programs in different industries separately, that would be a very bad approach. The Center for Strategic Studies has not really focused on development of cultural programs. You're missing that part of our life altogether. We need to think about creating new meanings. You have made great proposals, but that is not enough. People socialize not only in universities, they socialize in several other domains. Another important point, who is going to implement the proposals that you have generated? I have read the presentation, and it looks like the government should play the key role in pretty much every field. The government has to develop sports, encourage healthy lifestyle, and do this thing and the other. I think you're not giving enough to the level of regions, cities. We cannot apply the same rules and the same measures to different parts of Russia. This is not going to work. It's nonsense. Look at schools. Teachers are getting wages financed by the regional governments. We have pretty much destroyed municipal healthcare systems. Was that the right move? Do we need those municipal healthcare organizations? Would they make a decent contribution to people's health? What should be our strategy there? This is a matter of principle. Who is going to do it? Whose job is this? Should municipalities do this? Should regions do this? Another important question that comes to my mind has to do with social insurance. That is a huge thing in the strategy that covers the period between 2024 and 2034. We see a different approach. Social insurance is a model that will take a lot of burden from the government. Lots of things, including tariff policy for healthcare, for retirement pensions. It should all go there. That's where civil society can make its contribution. That's where representatives of labor organizations can play a role. Maybe when I get old, healthcare will be higher priority for me compared to pension. Maybe I don't want to pay so much to the pension fund. Maybe I want to make a bigger contribution to the healthcare insurance. Care insurance. Many countries believe that that is a solution for the elderly people. We have to identify all organizations that have to be involved, and not only organizations, families, households. We have to identify roles for all those entities. And now the final point on the matter of poverty. In the Soviet time, I worked for the government planning organization, and we were then developing the consumption baskets that are still used today. How much longer is it going to last? We have developed those instruments at the time of very low economy. We need to have a reform in the healthcare system. We keep arguing, we keep talking about those things. We should take those debates to a higher level. We should elevate the level of debate on poverty. Only 36% of families have real opportunities for development. It's about their money, it's about their initiative. We have 13% of the population that lives at the level of destitution. These people are important for our national economy. Where are they going? are they going down or are they going up? If we do not put all things together, if we do not create a holistic picture that would include taxes and other things, then we would not go far. Mind you, Yevgeny has finished on a rather pessimistic note, but he made a few interesting proposals. Alexei wants to make comments. I have enjoyed listening to the comments, many useful things. You mentioned tax maneuver. You said that it should be used in the same context as fiscal maneuver. I think that today this is a step of secondary importance. It would require a lot of support. We still have not found a solution for the pension fund and for the development of the pension system. We cannot have a pension fund that has over 50% deficit for growth, for greater incomes. We have to take a long journey. We see that today we can take better steps that would play a big role, although they may not be popular with the people. We cannot afford to spend our time on steps of secondary importance these days. We cannot afford to see increased volatility in the tax system because it's going to irritate very many people. The government decided against acting in that direction. Maybe the new government will, but I don't think that this is something that will be really, truly relevant in the coming 5 years.
I have this question for the presenters. I'm guessing that what they wanted to do was to answer those questions that were raised here today. The question I have is, well, certainly we will continue this discussion later on if necessary. Is there something that we need to say right away? I would take 1 minute of your time, because in 7 minutes there will be another discussion here, the discussion of education. Well, somebody criticized me for not really articulating Ms. Morozova and Ms. Zaleskina. They are the representatives of the funds that are dealing with this, and that is in continuation of the decree that was enacted recently, the presidential initiative to enhance care like this. And so I would like to invite you to join us. And let me say, the term social support is very inadequate. It has a lot of different meanings that can be implied or can be read into it. But sorry for interjecting. Let me say, as a witness, since I'm related to making all of this happen, it is indeed the priority for the presenters. But since Yuri didn't see it, that is something that we can look at as something we should focus more on later on. There are a lot of other things here. They are very useful pieces of advice with regard to what hasn't been done so far yet, only so far, and or with regard to the things that have been done but not really reaching out to the hearts and minds of those present here and outside this room, which means that we need work to do. Nelly, please. Well, thank you very much for the presentation, for the reports, and for the work you've done and that has gone into it. All of these issues have been discussed within a narrow circle of experts, but now we are sort of widening the scope of the discussion, which is very important because everyone can read and discuss it. But I wanted to respond to what Vladimir said.
So we're talking about a case where we have a half-breed. So on the one hand, we have the social insurance, but whether it's going to be the social insurance or is it going to be insurance-based. When Pushkin was writing his poem that I tried to quote from, the issue of gender was really not that important. But let us decide on which side the mandatory insurance belongs and what are going to be the risks we would be looking at. Or maybe we should say that this is going to be voluntary with all of the attributes that ensue. But then why would we need separate funds? Maybe one federal fund would be sufficient. So that means we need to identify who's going to be the stakeholders, what are going to be the functions of those stakeholders, and I hope that this presentation will serve as the foundation for the further discussion as to where we would attribute this social insurance, to which side we would put. We really enjoyed that you analyzed really carefully the model of the separation of responsibility in the healthcare system. The step has been made, but it's just the beginning of the process. We need to monitor this process. We certainly lack certain statistics that would show us the changes in the process, and we need to have more of that. We also need to analyze the effectiveness of penalties and fines. What has it given the system, or has it given the system anything? Maybe it has resulted in an ethical conflict between the doctors and the patients when ones would kill the others. That had never happened in the past in our healthcare system. Maybe there are other reasons for that, but that is not something that can be ignored by the study and the survey. I believe that this is one of the key issues of healthcare, the conflict between the medical staff and the patients. I think we are looking at the peak of this confrontation, and I think we need to find the root causes of this and take measures against the real roots of this, because from the emotional standpoint, the patients are quite aggressive towards the healthcare system, but please believe me, some of the doctors at least are quite aggressive towards their patients. As far as administration goes, in the context of the separation of responsibility, the current model is very administrative based. It is more administrative than even back in the USSR days. And there are a lot of things that could be done to enhance the system, and a lot of suggestions have been made in this presentation. They can serve as the analytical basis for further discussions, and that takes care of my presentation, or rather my comments. I wouldn't take more of your time. And I would like to add to what Nelly has just alluded to. There are some numbers, very important, that show the level of corruption in the healthcare field. And this is something that ought to be analyzed, because the roots of this corruption are in the economic relations. And if I may, we need to set before our healthcare system the task of ensuring that people that have chronic diseases are economically active. And we should separate the benefits for medicines from the handicapped, because in a lot of cases the handicapped are socially disadvantaged. But let me say that is something that is going to be outside the bounds of this discussion. Lilia, we have been discussing this for a long time. Let us, in a month's time, start a regular, monthly, open and broad seminar on those issues. The report was dedicated to. We will put together a schedule, we'll have an agenda, and we will be discussing this on an ongoing matter. And that's how it had been done before. I cannot say no to you, Alla. Well, the first thing I wanted to say, thank you to you, Lyudmila Nikolaevna, and that has been a brilliant presentation. It is very rare where you can listen to a well-presented report, which not only identifies issues and also identifies priorities quite clearly. Secondly, the report shows how certain problems can be used, and certain mechanisms, specific mechanisms have been provided. And this report is something that gave us the opportunity to work further with suggestions and proposals. That's what I wanted to end my presentation with. Continue these discussions, please. We are going to circulate in the next 2 weeks the schedule of meetings for the next period of time.